My name's Heidi Probst and I'm a reader in radiotherapy in the Allied Health Professions Division here at Sheffield Hallam University. Our project is called the To Inspire Project. The project was designed to investigate how identified entrepreneurs within radiotherapy had developed those entrepreneurial skills. So basically entrepreneurs are those corporate entrepreneurs, those people who work within the NHS who manage to make changes. They are the game changers really in the health service, the people who develop new services, new practices that actually make a difference to patient care. So why did we create the project? Well, I run a Level 7 Masters module on breast cancer radiotherapy, and it's designed for advanced practitioners, therapy radiographers, breast care nurses, registrars in training, or physicists, anybody who's working in the field of breast cancer who wants to learn a bit more detail about the radiotherapy part of the cancer journey. What I wanted to do in that module was encourage the students that study on that module to make a difference to their practice. So we wanted to do something more than just gaining academic credit. So we wanted to develop a pedagogy that would allow them to develop entrepreneurial skills and to make a real difference by making changes to their own practice. So what has been the impact on the learner experience? Well, the entrepreneurial enhanced pedagogy that we have developed uses problem-based learning, and what we do is we set authentic, real issues for the students to problem solve as part of the module, and that encourages them to go back and look at their own practice locally, to look at whether they can do things better. And what the students have identified to us is that while they find it challenging, it increases their confidence in their skills and their abilities to make changes locally. And what we've found through the module is that students report quite early on that they're actually making small changes to the way that they provide the services to patients and the care that they deliver. What we've also found is that at the start of the module, students are quite nervous about some of the challenges that we've set them. So we set these authentic tasks, but we also, at the end of the module, require them to write an outline business case, which can be quite a challenge to many of those students. But we find that they rise to that challenge really well. They find it demanding, but their feedback is really very positive. And if I could read just a piece of feedback from a student as an example. I don't think I will ever be able to express how grateful I am to you. My confidence was in the gutter this time last year. This role is like starting from the bottom all over again with lots of hard knocks on the way. You really empower people with this course. While I'm sure you won't miss my endless angst, you have to know that because of you I feel well armed and able to take on the challenges with greater confidence. Who knew I could make a Gantt chart or write a business case? So what have we learned by engaging in this project? Well, I think personally, what I've found is that actually students rise to the challenge. They embrace it, and while they report that it's been quite difficult and more demanding perhaps than other modules that they've studied with us, they gain a huge amount from the challenge that they're provided. And I think that experience of taking students out of their comfort zone enables them to have the confidence to apply those skills in practice when they finish their study with us. What are the next steps for this project? Well, at the moment we've got lots of qualitative feedback about the usefulness of the pedagogy and how developing entrepreneurial skills makes a difference to their practice. What we don't have is some hard quantitative evidence at the moment, so we need to now follow up on the students a couple of years on from their study with us to see what impact it has actually made and whether many of the outline business cases that they've written have actually been put into practice and been developed into new services. How did the Higher Education Academy help us with this project? Well, the HEA provided funding through an individual teacher development grant to support this project.